But New South Wales has other problems. You heard about them in question time. The Sydney hospitals and the tremendous load on them from COVID, even with a full lockdown on. The New South Wales government still has also not loaded up an authorised worker permit on the Service New South Wales website, as I understand it, having promised those for hotspot areas last Friday. A record number of cases in New South Wales today, 919, an Australian record, as Gladys Berejiklian continues to insist that case numbers will soon cease to matter.
No matter what the case numbers are doing, when you hit those high rates of vaccination, you're giving everybody protection. You're reducing the chance of the spread and you're keeping people out of hospital. And when you hit 70% double dose, as the Doherty report states, you start to transition into talking about the rate of hospitalisation, not the number of cases. The number of cases becomes less relevant.
Well, she's right about the relevance of case numbers. Death numbers will become much bigger news than case numbers after reopening, if the overseas experience is anything to go by. Westmead Hospital, one of the biggest hospitals in the state, shutting its doors to COVID patients for 24 hours and entering a code yellow. I've asked New South Wales Health for clarification on whether Liverpool and Nepean hospitals have joined them. Gladys Berejiklian insisting the hospitals are coping, saying there's no surprise that hospitals in areas where there are a lot of cases are experiencing trouble. And New South Wales Health Minister Brad Hazzard revealing the strain causing ambulance ramping in hospitals here.
Last week alone, Westmead Hospital had 280 patients who came in by ambulance with COVID. So about 40 ambulance deliveries a day with COVID.
And in Queensland, with Anastasia Palaszczuk, the Premier now ordering New South Wales visitors to hotel quarantine. She stopped people coming into that quarantine system for 2 weeks.
This has got to stop. It's too much pressure, so we have to put a pause. It's putting our workers at risk and it's also putting our community at risk as well. So starting from noon today, we are pausing arrivals into hotel quarantine for a period of 2 weeks.
And Andrew, no special treatment for members of Parliament. In fact, I'll just bring this up for you and for our viewers. A text message that was forwarded to me, sent to a cabinet minister from Queensland, and basically saying, don't come home, that you applied for and received a Queensland entry pass to enter Queensland as returning or new resident. Due to recent changes to border restrictions, your right of entry has been suspended until midday 8th of September 2021. If you've arrived in Queensland or will arrive before midday, or if your flight was in the air before midday today, you will still be permitted to Queensland. Otherwise, you will not be permitted. And down the bottom, please do not reply. It says it all, Andrew.
It is extraordinary, isn't it? And it shows how, for the federal politicians, this is really becoming an issue, these border restrictions. One of the reasons, no doubt, they're so keen on this 70 to 80% reopening, apart from the good of the nation, of course, and a way out of lockdowns. But so many of them have had to isolate for such long periods. On this occasion, what Kieran's revealed, not even allowed back to the home state they represent. Even Mark McGowan has allowed politicians and political staff from WA to return no matter what the rules. And you're talking about a pretty ordinary situation, a dangerous situation if you bar federal politicians from going back where they need to represent people. I mean, I'm aware of some ministers who've travelled back to Victoria who, because they've been in Canberra, have had to isolate. Michael Sukkar, the Assistant Treasurer, is one. And you just wonder why, when there are more cases in Melbourne than Canberra, Kieran.